Hello, everybody. Welcome back. Today I have Dr. Kirollus Nagi. He's known as the Keto Pharmacist in Egypt, and he is working to translate everything about mental health, injury, harm, deprescribing, different ways to treat mental health in the Middle Eastern countries to convert it or, to bring this information to those languages. The main problem is we see clients from overseas all the time, internationally, and there is no resources in their languages. They find us because we're English speaking countries. So he is bringing all this information to them so that it can help them. So I'm really excited to talk to him. And we're going to talk a little bit about mental health, metabolic therapies, why he became a pharmacist, and what information can help you in your journey. So first, Dr. Nagi, welcome to my YouTube channel.
Thanks for having me.
Okay, so first, can you please, you've shared it with me before, but will you share what led you to this whole problem and figuring out that the mental health system was doing harm?
Yeah, it's a very long story. It started with something very tragic. In 2018, I lost my brother to suicide after a very long struggle with depression, and the mental health system couldn't help him at all. This is what inspired me to do the kind of work that I'm doing today. Since that time, I began to really, I've started to have a real problem in life that I wanted to have a solution for. So I've started to do a lot of research and do a lot of reading, reading in psychology, reading in nutrition, trying to understand what drove my brother to have this final destination. At that time, I was just in I was in my first year of of pharmacy, and I've started to decide that I want to get into the mental health field, and I want to work in that field. And from that time, I've started to want to use all of my medical education that I'm learning in pharmacy, all of these things to target treating mental health problems. So I've started to study nutrition, mental health. While I was studying pharmacy, while I was measuring in pharmacy, I took like 2 diplomas in psychology. I studied one diploma in nutrition alongside with pharmacy. So I was just trying to gather all of the different tools that would help me deal with mental health problems and solve them. And eventually, I knew about metabolic mind and that wonderful field, and I knew that that's it. This is what I want to do because I've always knew that there is a correlation between nutrition and mental health, but it didn't crystallize it only when I saw a metabolic mind organization. It all makes sense, and I knew that this is what I want to do in my life. This is the kind of work that I want to do, to offer that holistic kind of treatment to people. So this is briefly my story. I hope that I answered this question.
Yeah, it's perfect. So you make me think about differing perspectives and how we each kind of have our own unique viewpoint on perspective on things. And so you have the perspective of both a pharmacist, a family member, and a clinician, but also like somebody that does metabolic therapy with people and lifestyle intervention and things like that. So can you explain the difference between treating a mental health problem pharmacologically versus treating some mental health problems with metabolic therapies and lifestyle interventions? Like, what is the difference?
Yeah, it's very different. Two different approaches. The first one simply deals with the symptoms. It's like taking a painkiller. It's like taking ibuprofen for your physical pain. It doesn't treat the root cause. It doesn't handle the root cause. But it even makes it all get worse. For example, we know that SSRIs and antipsychotics and all of these medications have metabolic side effects. They cause insulin resistance. They make people gain weight. They instead of helping people, they make things worse on the long term. So the first approach simply tries to numb the symptoms, try to mask the symptoms. But the second approach, when we talk about metabolic psychiatry, it targets the root cause. It's targeting the main problem, what is biologically happening in the brain. So this is the main difference between the two approaches.
Yeah. So I think like in the United States, this is just what I've noticed. This is probably going to sound judgmental to my audience, but we are comfortable. We're in 70 degrees all day because we have air conditioning and heat. We barely go outside. We're on our phones and our devices. We eat junk food. And then we are upset when we don't feel good. We don't have meaningful connection in our lives. So we kind of think about mental health like, let me just take my body to a doctor and let them fix me and let them give me pills. But like, I don't really need to do anything to take care of my body. So can you talk a little bit about the state of mental health in the Middle East and in Egypt, especially? What do you see? Like, what are some of the problems that are happening in your country? What are people doing to treat it? And just like, I guess, what you think about mental health and physical health and how those two are related.
Okay, great question. To summarize what is happening here in Egypt, it's like we are always 10 years behind the Western world. So yeah, it's like 10 years lag. So if we have all of the problems that you are suffering from, except that 10 years behind. So it's even worse.
Okay.
People like enter psychiatric offices, psychiatric clinics, and they just get in 15 minutes they are prescribed a medication, and the psychiatrist simply say to someone, take this and you will be okay. Your next appointment is 1 month later. We also have the problem of wrong prescribing. So we still have that horrible advice that when you stop the medication, simply have the dose, take it for 2 weeks, and have those again, and take it for 2 weeks, and everything will be okay. So we don't have anyone who is well informed about the science of hyperbolic tearing and all of that. The main two problems, I believe, is that we are still adopting the classic psychiatric approach dealing with mental illness. That the chemical imbalance theory of SSRIs, that depression is a lack of serotonin in the brain, and all of this crap. So
Yeah.
yeah. So this is still working. This is still happening here, and of course the problem with the wrong prescribing, too much fast triggering of medication. So this is really causing a lot of injuries and psychiatrists are gaslighting like a lot of people, saying when people start to feel that something is wrong, they don't question their approach. They blame the patients, telling them that no, these drugs can't cause these kind of withdrawal symptoms. Wait, and everything will be okay. And they are not well informed about any of the withdrawal symptoms that could happen from these medications. And I want to shock you about something that your audience will be shocked about. Here in Egypt, we have very, very, very weird thing. You can enter any pharmacy, okay, and you can get a psychiatric drug without a prescription.
Over counter. Yep. It doesn't shock me
So
because I went to India and I ran out of Effexor when I was in India and I bought it over the counter. Yep. So it doesn't shock me. Okay, but so does that mean is a lot of the population taking these medications without guidance at all?
yeah, some people are like they heard someone telling people that Cipralex is good for anxiety, and he simply goes and take it by himself.
And then
Yeah,
they don't know how to get off of it safely either.
of course.
Wow. That's amazing. Okay, but
So,
one thing I have to tell you, it's everything you just ex described is exactly what's happening in the United States. So maybe you're not 10 years behind. But I feel like we're 10 years behind England because at least they are starting to recognize antidepressant withdrawal as a major problem. So I
mhm.
think they're talking about it a little bit more than we are. But what you described is exactly what's happening here. I only know about 10 doctors that I can refer to that really understand this in the United States. That's it. 10. 10.
Mhm.
Oh, so, okay, I have a question because I know you've done tons of reading and I'm just so it's just so validating to me to find people that are literally 7,000 miles away who believe and understand things very similarly to myself. It's just fascinating. Like you're independently have come to the same conclusion. So I want to hear from you just because you have a pharmacy background, what is happening with us internally when we come off these drugs? Like what do you understand about the injury? From a pharmacist perspective. What is happening?
Yes, it's to simply say it's like you've given your brain you make your brain dependent upon an external substance. It's like for a very long time. So receptors that start to adapt with the presence of that substance. So and our nervous system is not that neuroplastic. It's not that flexible. It needs time to adapt or to adjust to something. So if we simply take a substance that the brain adapts to and builds a dependence upon, and we abruptly pull this substance from the brain, the brain is not plastic enough to adjust with that abrupt withdrawal. So for me, protracted withdrawal and that kind of injuries happen because our nervous system is not designed to be able to handle abrupt withdrawal of something that he was dependent upon for so many years.
Right.
So it's kind of injury, but as you and your audience, of course, know, it's not permanent injury, and people eventually heal, fortunately. So this is how I understand it. That
Mm.
it's the inability of the body to fastly adjust to the absence of the medication.
Yeah. The way I explain it to my audience is there's this communication highway in our bodies. And in between there, we put a drug, and that kind of disturbs what the body knows how to do on its own. And then once we keep doing that, you know, that communication highway has potholes and it doesn't work the same way. And it's either we have too much or slow down and things are just chaos. And your body's like, what the heck just happened? I'm trying to fix what just happened. What did you do to me? You know? Because we see injuries, as you know, from people that took it a week or people that took one pill. And it's like it got interrupted. What do you think about that? Like from a pharmacy, like how these drugs work.
Okay, so I believe that uh, everyone's nervous system is different from someone else. So some
Hmm.
people are simply very very sensitive. They have very very sensitive nervous systems, and even as you said, if they just take like one dose of the medication, or they are the 1% of the 1% that can get really paradoxical
Yeah.
weird side effects and injuries from these drugs.
Hmm.
So I think this is I think that uh, um, I don't know what was the question because I think I
Oh,
lost.
not really a question, just discussing. It's but you
Uh,
answered it that some people are just more sensitive. Some people can take these drugs
mm,
for 30 years, have no side effects, can come off perfectly easy, and then some of us are just not so lucky, you know? That's it. You answered it. Okay, so let's move on to health because that's my favorite topic. So,
okay.
if pills can injure some of us and we don't have that as an option anymore, because I tried all the pills. Like they made me worse. They worked for a while and then they didn't. So now I can't go back to pills and I don't want to manage symptoms, but I want to feel better and I want to feel more healthy. So I'm on day 31 of keto, as you know, and let me share with you what has happened so far. Within 3 days, I felt like just more clear. I had energy in the evenings after work to like go for a walk, to exercise. My sleep I thought was fine, but my sleep got better. It got a little deeper. I felt more rested and I felt ready to go when I would wake up, where before I was kind of dragging a little bit. I also felt like my baseline to handle stress and to handle a little bit of anxiety was like better. Almost like it's okay, I'm just a little anxious, it's fine, like no big deal. Whereas before maybe it's like, uh-oh, I'm a little anxious, like what does this mean? So like something changed inside of me that was very subtle but like very meaningful. And that has implications for my life. When I have more energy, I want to exercise. When I feel better in the morning, I get up earlier. I might be more productive. I might be able to make breakfast earlier, things like that, which, I think we just don't give it credit that our physical health is absolutely related to our mental health. So it's just one thing. It's how do we feel and how healthy are we and what are we feeding our bodies? So can you talk a little bit about health and mental health from a physical and ketogenic and metabolic standpoint?
Yeah, great question. Uh, I think that our major problem in the mental health field right now is that this huge gap and huge disconnection between physical health and mental health. It's like we completely have forgotten that there is something called the neck that connects the body to the brain. It's really absurd. When someone gets on a ketogenic diet, like what you are doing right now, we know scientifically that there's a lot of mechanisms that's going on to improve the mental health. We are talking about mainly four main mechanisms that ketogenic therapies improve mental health. The first mechanism is that it improves insulin resistance. So if there's any kind of insulin resistance, it's completely healed. And I was talking to Dr. Matt Bernstein, and he told me previously something very very interesting. He told me that even if you don't have insulin resistance in your tests, in your lab tests, physical insulin resistance, you can still have insulin resistance in your brain, and you don't know that. So yeah, it was really interesting things to know about. So yeah, ketones don't need insulin at all. So they simply reach the brain cells without insulin. So this is really important thing. The second mechanism, we know that they reduce oxidative stress. Oxidative stress is like we can use the analogy of kind of debris that gets produced after the process of producing energy. Like there is waste products that are need to be cleaned up. So ketones improve that. Ketones also reduce neuroinflammation. And this is very 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 important subject. And also ketones uh, increase the number of what is called mitochondria, or the powerhouse of the cell. They cause something called mitochondrial biogenesis. So they increase the number of these powerhouse of the cells, and the mitochondria aren't simply producing energy; they are doing in the body a very very huge number of things. So they are not just producing energy; they are doing a lot of other things than that. So when someone gets on a ketogenic diet, their mitochondria improves. So this is the four mechanisms that makes someone eventually feels better on that diet, and this is why you are feeling much better right now.
It's wild. Like I have a keto coach and it's Laurent, sorry, Nicole Laurent,
Mm.
who I
Yeah, I
interviewed
had it. I know
yeah,
it.
a couple months ago. And when I went back to her, well, when I went to her the first time, right as I was starting, I said, Nicole, I really think I need therapy because I'm dealing with stress and grief from a loss of a parent. And like, I just feel overwhelmed. And she's like, Angie, just give me 2 weeks. She kept saying, give me 2 weeks. Just give me 2 weeks. And I was like, so skeptical. Like, okay, but because I've done keto before, but it was a different time in my life. But it goes to show you. She told me also, let's talk about this really quick. She told me that beta hydroxybutyrate is the byproduct of ketones. So when your body starts producing these ketones, that BHB is kind of lowering your inflammation, giving you more energy. It's almost like it's you have your own painkiller inside of you or something. But for me, it's like when my brain feels better, when it's getting better, cleaner energy, everything works better. So can you maybe explain that mechanism? Because you mentioned neuroinflammation. And so, like, talk about that neuroinflammation and BHB maybe.
Yeah, it's the topic of neuroinflammation is a really interesting one. I really love the ideas of Dr. Martin Picard. He is a very, very famous famous researcher in the metabolic psychiatry field. He simply explains that neuroinflammation is something that happens when the brain cells, um, like when we get into stressful life events and stressful situations, our brain cells are required to work more than they are usually work. So there's our like overload on them. Stress is about high demand. It's like it demands them to produce energy and work in a very very high levels. So uh, neuroinflammation happens when the cell can't its energy production inside its mitochondria can't meet up with that energy demand that the stressful life events put on it. So neuroinflammation happens when there is this gap between what the energy produces, the energy that is produced inside the cell, and the demand and the consumption of the energy. So this is what eventually causes the cells to become inflamed. So inflammation in the brain is simply a problem with brain energy, with the production of energy inside the brain. So when someone starts to implement ketogenic therapies and starts to take some supplements, for example, like some supplements that work on increasing the production of ATP inside the mitochondria and the inside Krebs cycle, something like creatine monohydrate, which is a really interesting one. When someone starts to do these things, he improves the production of energy. So the cell is able to produce energy to meet that high demand that the stressful life events put on it. So that's why keto diet lowers brain inflammation, because it improves the energy production inside the cell. I hope that I explained
It's
this
perfect. You said it
clearly.
perfect. Perfect. And it
Yeah.
helped me understand like what was happening because in my job I always feel like I'm on, like I have to be on. And so there's that takes a lot of mental energy to be paying attention to my clients on Zoom and talking to them and tracking what they're saying. And so the my brain is working extra hard like all day. And not to say that doesn't mean I need to reduce my workload because I have, but also like what you're saying is just to meet that demand that I'm putting on it, that I'm asking it to do, that bodies and brains do adapt to sometimes. It just needs better fuel to do that and better energy to do that and the available resources to do that. So for instance, like sometimes I could have like 3 sessions in a row and then I'm just like, I'm exhausted. But this is like because it's cleaner energy and I've reduced my workload, it's like it just works better. It just feels better. It's not so demanding, I guess. But also I wanted to mention, while you were saying that, we do have evidence from Chris Masterjohn's work about the impact of SSRIs on mitochondria. So we got kind of a double whammy. We have the demands of the modern world, we have stressful lives, and we have not so good food. So you're kind of getting kicked twice by the stress and the neuroinflammation, but also by the antidepressants that you could be taking. So, yeah. So let's talk about another topic about health and mental health. In America, this is basically what's going on. Everybody is kind of socialized to believe that you just go to the doctor and you take a pill. And like you don't really have to do anything about your life. You don't really need to look at bad patterns or your overwork schedule, or maybe you're in bad relationships. But also on top of it, we don't really see sunlight a lot. A lot of people just live inside most of the day. People are not sleeping. They're on their phone late at night. People are doom scrolling all day, so their attention span is shorter and shorter. They live in 70 degrees Fahrenheit all day. So they don't like their body doesn't have a hermetic stress of like cold weather and then hot weather and then cold weather and then hot weather. So we're just very comfortable. We're kind of lazy. And like the whole population is kind of like that. I know that sounds judgmental, but that's just the state of America right now. We're so comfortable. We don't we don't want anything. We don't want to have to do any work. We just like go to the doctor and take a pill. Okay, so the people that I work with have done that, and like they're kind of at a dead end. Like, okay, I did that. The pills didn't really work. And in fact, they've injured me somehow temporarily. So now I have to find other things to do. So I would ask, how do you work with people that have been injured? What is some hope that you can tell them? Or like, how do you work with the people that you meet in the Middle Eastern countries like us?
Okay, great question. Uh, like my approach to therapy and treatment is a holistic approach. Uh, I try to tackle the problem with from all different angles. So so what I do to help someone who is suffering from whatever symptoms he have, uh, I work on improving the first intervention targets. Like the first intervention targets the biological causes, the biological root cause of the disease. So ketogenic therapies is implemented here. Some functional medicine, like there is a lot of like blood work that and lab tests that we do to check if there is any things that are not correct, and we fix these things, and we will improve after fixing these things. So the biological uh, layer is really important. Secondly, I offered what I do is offering psychological treatment and weekly psychotherapy sessions to target the psychological part of the problem. If the stress, like we said, we were saying that at the root cause of the problem. So how when I work with someone to help him solve his problems in life and improve his life circumstances. So the stress levels in his life start to decrease. Uh, his problem
Better.
eventually, yeah, everything gets better. The neuroinflammation decreases because the demand on the cells decrease. So this is my main approach that I use in helping people recover. I try to offer that
Yeah.
holistic approach that deals with the problem from all different angles.
Yeah, I totally agree with you. And I do that for myself. So I like to think about, and with clients, like if somebody tells me I'm having really bad headaches, Angie, I'm like, okay, what are you eating? That's like my first question. Like, and the way Nicole kind of taught me was like, you got to start with biology. Like, let's just get your food straight. Like, start somewhere, you know? Because if you can just get the way your body is working, sleep is another one. You know, a lot of people that have this injury, they can't sleep, and it's just that's part of the process. They will get it back, but like for me, that's off a while. Like my sleep is so precious to me. I do not let anyone mess with it. My phone is off. I do not wake up to an alarm clock. I wake up to sunlight. Um, I am so protective around my sleep because it to me it's like my sleep and my food are the number two things. If they are not right, I don't feel good. Period. And it's nothing about I need to do CBT on my mood. No, my mood isn't good because my food yesterday was bad or whatever the thing is, you know what I mean? So food and sleep are like number two, the two top things for me. And then like now recently I've been working on my like old trauma patterns, for instance, like relationships I get triggered in because I feel like people don't understand me. I'm just being hypothetical, okay? So then I have to like I work on that stuff later. but it's all kind of together. You know what I mean? So I think while you were talking, I was thinking of it like stacks of cheese. You know, you're stacking each block on top of each other. You can't just take one block of cheese and just take a pill for that. We've all done that, and look what happened. You know, it's a lot of things in our lives. Relationships,
Mhm.
are we getting out in nature? Do we have meaningful work? How do we talk to ourselves? What are our belief systems about the world? A lot of us don't feel safe. You know, I don't feel safe in the world. I have been hurt by everybody that knows me, you know? So it's like all these things are what contributes to mental health and health. It's not just one thing and it's not just one
Mhm.
answer. And even when I look back on my own healing process, I always think like, well, what was it that did it? And it wasn't one thing. It was a lot of little things that just added up. So I don't know.
Yeah,
Do you have any comments about that?
yeah. I have one comment about that, and the comment is simply uh, some of I believe that one of the major problems that we suffer from in our current era, uh, we want to oversimplify and make everything very easy, and we sometimes forget that there's some things in life that really need effort. Uh, for example, one of the main things that people need to do some work on is existential crisis and finding meaning in their lives. Okay, this is a really very important thing that we in our current world we don't really have that sense of meaning and belonging and since spirituality was taken from the Western world and the post-modernism and all of that, I believe that the Western world and started to become like some nihilistic
Yeah.
about existence itself.
Yeah.
Uh,
Yeah.
we don't have that worldview that make us understand the world and that makes it meaningful to us.
Yeah.
So I really love, for example, I really love the podcast of Roger McFarlane.
Oh yeah.
He's bringing all of these ideas, like he's criticizing the system in a very yeah, strong way,
Yes.
talking about all of these subjects about how we lost our connection to, let's call it the universe, the gods,
Spirit.
cosmic
Yes.
intelligence, whatever. But we are spiritual creatures. When no one can deny that.
Yeah.
We have that dimension in us.
Mhm.
So the problem is that people don't want to do the effort that is needed to discover their purpose, discover their meaning in life, to invest in, to have a meaningful careers, meaningful jobs, and they just want to go to someone who prescribes them a magic pill that makes everything perfect, makes everything alright. It's so silly.
It doesn't make
Right,
sense.
life. Yeah,
No.
unfortunately, life is so hard, and you have to accept it. Sorry to say it,
Yeah.
but life is hard, and
Yeah.
we have to accept it. Some so this is one of the problems that I believe that is something is wrong in this area and in our understanding to
Well,
it.
and for me, from my perspective, what you just said is so important because I think this is just my personal opinion because churches became corrupt either with money or sexual assault on young children, okay? Because people were more enticed by social media and culture and society, we kind of lost that spiritual connection, right? So then, or we just didn't trust it, or we just thought it was a waste of time because we had to work so hard and we don't have time for church or spiritual belief or things like that. So then diagnosis comes in as, you know, a person doesn't feel good. And I actually learned this from like a 20-year-old. She said, I felt like something was wrong with me. Like I don't understand the world. Like something's off. And something is off. A lot is off. Okay, so you're picking up on that. Like this is a weird world that we live in that everybody needs to make lots of money to live and we're all working to pay our rent and nobody's really enjoying themselves and everybody's pretty miserable.
Mm-hmm.
But instead of
Exactly.
like seeing that from a spiritual perspective, because we don't have a place to go do that we trust, then when you say something is wrong with me, I don't feel right, something is off, psychiatry will hand you a reason for you to feel that you the way you do. Well, that's your depression. You're depressed about the world. That's you have low mood. So, like, here's a pill for that. So then we latch on to these diagnoses as an identity because it makes us understand why we don't feel right in this society. But it's
It
misplaced. It's
it,
not
it
us.
gives our suffering meaning.
Yeah. Yeah. Also, someone in one of my groups this week, they said, we came to this planet to love and to hurt. And I was like, it's so
Mm.
simple and so beautiful, but it is. And so, unfortunately, for those of us that have been injured by the mental health system, I feel like we're a little bit ahead of the game. I don't like how we got there, but we tried all the things that they were selling. We've done everything that was suggested to us. We were good patients. And then we had a dead end. And then we realized I can't outsource my healing to these people anymore because they actually hurt me and they took me away from my healing. So now I have to heal myself. And now I got to figure out what that means. And I think it's very spiritual if you think about it. And I really love Carl Jung and depth psychology for this kind of stuff. Like, I'm
Hmm.
so into it because it's like there's something in our bodies that is always trying to take us toward health. It just is. It's innate. Or it's like it's trying to take me to my own potential. And like you can't ignore that forever. It's going to keep following you because it's inside of you. And you can call it yourself or your higher self or spirit or whatever. There's lots of names for it, but you can't run away from yourself. So this injury, I never thought we would get here in this interview, but this injury has a way of it's like taking you back to yourself and your relationship to yourself and figuring out what you need to be healthy and what you need to be mentally healthy. And that's kind of up to you. But it's like it wasn't the way that we were sold. It sure was not that
Hmm.
way.
Yeah,
What do you
it
think?
was C.S. Lewis beautifully said that pain is pain is God's megaphone to arouse a deaf world. Yeah, he is famous for that quote.
Wow,
So
I like that.
yeah, that God uses pain to make us awake to what is important in life. So,
Yeah.
and this is my personal story. I was living like a very trivial existence. I was
Hmm.
not doing anything of much importance in my life before that death of my brother. And when I suffered this, and it made me take life seriously. It made me question everything. It was a healthy kind of anxiety, healthy kind of crisis that
Wow.
eventually led me to discover meaning and to discover my life purpose.
That's
So yeah,
beautiful.
I think that pain, some pain in a lot of times is necessarily something necessary in life. Yeah, we all hate it. I am I am not a big fan of it, but it looks like it's something necessarily in order for us
Yeah.
to grow uh, into who we should be, the kind of
Yep.
persons that our potential
Our
to
potential.
actualize that potential.
Yep.
Yeah.
Yep. I just the only added thing I have to say for my audience is just I feel like especially for us, like we were just socialized to believe that medicine had that answer. And so we made this mistake of trusting them. And the amount of pain that we got was like 1,000 fold. We didn't deserve any of this. Like we all had this very I would say naive and pure intention, like I just want to feel better. I need healing. And so we went to the people that we thought had it. It was not them. It's not them. So
Yeah.
while this journey for us is like very empowering, it's also like unnecessary. It shouldn't have happened. It's horrific because you've seen it too. You've told me about some of your clients and how injured they can be, and it's just like, oh my God, this is why did this happen? You know, I don't know. Okay, so let me check my questions really quick. Uh-oh, wait, I lost the screen. Here, let me come back. Hold on. Okay. I think I got it to everything I wanted to ask you, Dr. Nagi. Do you have any topics you want to
Mm.
discuss besides what we've already talked about, or anything that you'd like to add from your point of view?
Yeah, I think we covered,
We
like, we got
covered a
into
lot.
existential
Yeah, I
questions.
love it.
It was yeah,
I
it was
think,
very, very.
yeah, I
Hmm.
like it. I think I have one more question for you just because I'm curious, because almost every single person I've ever interviewed, they always tell me what changed my life was reading Robert Whitaker's Anatomy of an Epidemic. And I know
Okay.
you've read that, right?
Yeah, I know this work, of course.
Yeah. And so I just find it fascinating that you found Joanna Moncrief, Mark Horowitz, James Davies, Roger McFillin, Robert Whitaker. Can you just share from like your point of view, what have those writings, what have those people, I don't know, done to change your mind or point of view? Or like, what do you agree with? Or what do you don't agree with,
Hmm.
maybe? I don't know. Because we both read the
Okay.
same things, basically. Yeah.
Yeah. Yeah, I think the the core the core thing that they offer, the main thing they offer is that, uh, for me, uh, the problem is that psychiatry is so reductionistic in the way it treats and looks on mental illnesses and mental problems. So, uh, when I got into all of these things and when I started reading all of these things, uh, it made sense for me that we are reducing the problem to something very, 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 very small and very, very silly. It cannot be just a chemical imbalance in the brain. It cannot be this simple. There is a lot of components that we are not dealing with. We are not looking at what is happening in someone's life. We are not looking at his existential crisis that he is going through.
Mm-hmm.
How can a bill solve something like that? How can a bill give someone meaning in life? How can a bill fix someone's relationships? Uh, yeah, I don't remember exactly when was the time that I discovered or I realized that something was really wrong, but
Mm-hmm.
I've always felt that the system is not working correctly. I don't I don't realize I need to do some writing about it, but I don't really remember when was the time that I realized that there is something wrong in this field. But yeah, I I agree with you that we all reached at a certain point we reached the same conclusion that something is wrong and we have to change it. We are called to change it, and this is what I'm trying to do in my
I
work.
know.
I'm this is what I'm trying to do in my Arabic region, trying to make this transformation happen, to make this change. Um, so so yeah, this is my answer.
So what do you think it's going to take from your point of view to make, because the way you said it was so beautiful to me, the word that came to my mind was antiquated. Do you know that word, antiquated? Like it's historic.
Not.
Like it's it doesn't work anymore because it's an old model. So it should be put
Mm,
away. It's old.
yeah.
It doesn't work. So, but when I think of psychiatry, if you just go on Twitter and you read mainstream psychiatrists, they are so entrenched in that belief system, they can't even understand anything outside of it. And actually, I would argue the more
Mm-hmm.
you argue with them, the more they believe what they believe. And it just keeps perpetuating itself. So, what do you think it's going to take for people to change or understand this differently?
Uh, it will take a lot of suffering, of course. Unfortunately, many people need to to be hurt by the system in order for the system to change. And the victims of the systems are the ones who will revolutionize, make a revolution against the system eventually. The victims will like gather up and make a huge revolution that will destroy the system eventually. Um, so one, so it will take a lot of it needs a lot of courage of the people who were hurt by the system to speak up and to share their stories and to do some mental health awareness to others in order for the system itself to begin to change. Uh, yeah. Unfortunately, there will be no easier way because behind this corrupt system is a lot of money and a lot of power and a lot of politics, a lot of
Yeah.
politics also about it.
Yeah.
So yeah, there will no it will not be easy, but I believe that
I
very
think it's
soon
happening.
yeah,
Yeah,
it's happening already. Yeah.
yeah, it's happening. It's just slow and it's very it's hard to watch. It's just really it's almost like if you think about let's go back to existential things. There's just these different levels of consciousness. One is stuck at this level and another is up here. Like, you know,
Mm-hmm.
not that I'm trying to say that like one is better than another. It kind of is. One's more humane for sure. One is more holistic in its thinking. One is more reductionistic, but it's just like there's these two different levels of consciousness and they cannot communicate to each other. You know, it's hard to watch, honestly. Even just seeing things that people yesterday, maybe I shouldn't say this, but I will. Yesterday I was on social media and there was somebody in a comment that said they were breastfeeding their child while on an antidepressant. And then somebody said
Mm-hmm.
like, well, have you researched that? Have you looked into that? And they were like cheering about it like it was like a really good thing. And I was like, I can't even read this. Like, I can't read this. Like, you don't know what you're doing to yourself and your baby. Like, I don't even know what you're doing because we don't even know. But like, that's not a good
Mm-hmm.
thing to brag about. It just like hurt my feelings like on a deep level, like a soul level. Like, what are we doing to our babies? You know?
Yeah, it reminds me of the the history of smoking and
Yeah.
cigarettes. How when it was said that it will improve it improves your health and it's good for you.
Yeah.
It's like history is repeating itself
Repeating
with
itself.
uh,
Yep.
yeah.
Yep. It is. But I want to say thank you to you for being part of the change and being there to translate some of this information into another language so that people can find the information easier because it's a global problem. Like I have people in Poland that are trying to organize right now to do the same thing for Polish, people. I have people in Australia, like we don't have any services here. We need help. And so then they come to me from Australia and they're zooming from 14 hours ahead. Um, there's people, I have a person in Iran that I've helped and now I can't get in touch with him and I'm so worried, you know? And I'm just like, wow, this is a global problem, but people have very low resources. And so they just believe themselves to be mentally ill. And then they're right back in the system, by the system that
Mm-hmm.
hurt them, but they just don't even have the paradigm or language to understand what's happening, possibly. So thank you for doing that work because it is so important, especially right now. Okay, so
Yeah.
to shift the mood a little, because this is our last question, but I like to ask every single guest the same question. So I'd like you to think about what kind of hope you can bring to the people that are watching. What do you see as far as healing? What kind of stories, success, ways of being have you seen? Just a little hope for the audience.
Yeah, if I would leave a message of hope to them, it would be that you are not your diagnosis. Your diagnosis is not a chronic condition. Don't ever let someone tell you and or make you believe that you are mentally ill and don't let anyone define you by your mental illness. Uh, you there is nothing called chronic disease. Okay, so there is a solution. We have a solution. We have something that really works. You just need to reach it and implement it in your life to find the true healing and the true freedom from your disease. This is what I would love to leave to someone who's hearing this right now. It's not chronic. It's not permanent. Refuse the label. Get rid of that label that was put on you, and start welcoming a new identity and a new freedom.
So beautiful, Dr. Nagi. Thank you. And I just love your heart. I have to say that. I love the people that I find because your heart is just so big. I can feel it through the camera from thousands of miles away. So thank you for being who you are.
Thanks. It's an honor to be doing what I am doing today.
I love it. All right. Thank you, everybody, for watching. If you have comments, please leave them below. If you're in Egypt and want Dr. Nagi's services, I will put the link in the caption. But I think you can come back and answer any comments, right? If anybody leaves any comments, you might come back and
Yeah,
visit.
yeah,
Great.
yeah, yeah, sure.
Perfect. Thank you so much, Dr. Nagi. Thank you for everybody for watching, and we will see you next time.